Second delay and then begin.
Great. So welcome everybody. I'm Dave Velasquez.
Uh-oh. Chair Velasquez, we look like we're having a problem.
Dr. Dukes have had the honor and continue to have the honor of co-chairing county.
So what we'll do is, Ms. Wilson, if you send Mr. Velasquez just a text, and as soon as his sound gets together, we'll allow him to come back in. But what I'll do is go ahead and make the introductions. Want to remind our public and certainly those who are both viewing us and those who are in the Zoom meeting that we are being recorded, and that this recording will serve as the minutes for the Path Forward Task Force and will be posted on the website. We are joined today by County Executive Angela Alston-Brooks, and would like to turn it over to the County Executive for some opening remarks.
All right, good afternoon, everyone. I'm so happy to see all of your faces this afternoon. So grateful for your presence. And before I begin my remarks here, I just have to say a really heartfelt thank you to each of you. You know, I had a moment, I was sitting here thinking about something that Wayne Curry said to me several years ago. And he said, you know, in the course of your career, you're going to go into a few fights. And he said, you know, it's my recommendation that you surround yourself with the right herd so that when the fight starts, whatever the enemy is, we'll have to decide whether to take out just you or the whole herd. Mm-hmm. And I looked on the screen just now and I thought, what a wonderful herd that I surrounded myself with during the course of a fight that I didn't anticipate, did not invite, didn't really even plan for, you know. So this whole pandemic, of all the things that we planned, and I tell you, David Sloan, the whole team will tell you, we tried to anticipate every challenge we might see during the course of our time in office, but the pandemic we forgot to put on the list. But nonetheless, you know, I want to thank you for hearing from us, for even receiving the call and agreeing to work with us during this pandemic. And I could not have selected a better herd. I think Wayne Curry would be proud of the herd that we were able to assemble. So I'm happy to join today's full task force meeting. And I, of course, want to thank our super amazing task force co-chairs, the Dr. Charlene Dukes, who hasn't told me no yet, but I'm going to, you know, I'm going to try to be careful because I know she's retired, has a new grandbaby, and the nose may come sometime soon. I also want to thank David Velasquez for his leadership. Since this past June, you have guided this broadly skilled team of experts toward one goal, and that was a better Prince George's County. And I want to thank everyone who has worked so hard to position our community to emerge from this pandemic stronger than ever. Today, I'm excited to receive the third and final report from the Forward Task Force, and I know it will contain some level of carefully considered, well-researched, and above all, thoughtful recommendations that I've come to expect from this group. I also want to acknowledge all of the subcommittee chairs, all of the task force members and administration staff. Because of your time and the efforts that you have made, we have made so much progress and positive change for our community. As we continue to increase vaccine distribution, Prince George's County is getting closer and closer to beating COVID-19 once and for all. Every day, more and more Prince Georgians are proud to be protected from COVID-19. As we emerge from the pandemic, our county is better positioned to succeed in a changing environment because of the Forward Task Force. We started this task force last June because we knew that our community couldn't wait for the pandemic to be over to start making critical changes, and we had to act quickly to ensure that we were in the best possible position to recover from COVID-19 as a county. Every member of this task force understood the stakes, and you all certainly rose to the challenge. Our 5 recovery groups and all of the amazing volunteers who gave their time to the task force got to work immediately. And each of you brought ideas and expertise together to provide thoughtful recommendations, which now help to guide our recovery. I'm proud to say that your work has really helped to prepare our county for a brighter future. The first two reports offered recommendations for the immediate and short-term needs of our community, and we've adopted those recommendations, and our county government is currently working to implement them fully. In the meantime, our residents are already seeing the benefits. Today, we turn to the final set of forward task force recommendations contained in the third report, entitled A Refined Future, which focuses on long-term solutions for Prince George's County. I look forward to once again hearing your vision for a stronger Prince George's County. And now I want to turn it over. I think he's back on the line, David Velasquez. Was he able to make it back on?
Yes, hopefully I'm back on now.
Oh, there he is. Okay, there he is. Thank you. And to our subcommittee chairs for their presentations on the final report. Thanks so much again. And I'll hand it over to you now, David.
County Executive, thank you again for those remarks, but also, and I apologize for the difficulties in connecting, but also again, your leadership team and everyone from the county, your attention, your help for all these work groups, which we're about to go through, has been critical to their success. And just to comment, as you have commented, and Dr. Dukes, the pandemic has brought real challenges to how we live and work. And we've proven through this task force time and time again, the way we're working, that we're in this together. And everything we're doing, and each one of us has had the opportunity to help support more than 900,000 residents of the great county of Prince George's as well. Being a part of this ambitious plan, as we're going to talk about today, to reimagine our future, I'll say I know for all of us has been one of the most inspiring, but probably also one of the most humbling experiences we've had. And it's because of the county executive's commitment to every Prince Georgian that we have all worked together very hard and very long to provide recommendations to help us emerge even stronger from this pandemic. From the outset to today, I know the Forward Task Force was charged with providing actionable, concrete recommendations across a broad spectrum of policy areas that are going to aid Prince George's recovery and are also going to equip the county to better respond to any future crisis that may come. Dr. Dukes?
What I would say as a part of this is that actually we wanted to ensure, we've said it once, we'll say it again, that we had a team of experienced and bright leaders and problem solvers from across our region. The task force subcommittees are led by these very people who are committed and thoughtful leaders. They are experts in their fields, and they share a deep understanding of our county and the region. They have the knowledge and practical know-how to help our county emerge from this pandemic even stronger. They use their talents, their skills, their resources, and their commitments every day to get us to where we are today. Almost 10 months later, presenting the final set of recommendations, a redefined future to County Executive Also Brooks, her leadership team, and to you, the public, for consideration as the work turns to the next 3 to 5 years. The subcommittees, I've said it before and we'll say it again, are comprised of Prince Georgians and Marylanders who are diverse in background, professional and experience, but united to ensure that there is a thriving future for our county. The task force is organized in 5 key areas. The Health Recovery Subcommittee chaired by Dr. Joseph Wright, the Health, who is the Senior Vice President and Chief Medical Officer at the University of Maryland Capital Region Health. The Education Recovery Subcommittee is chaired by Dr. Darrell Pines, the President of the University of Maryland College Park. The Economic Recovery Subcommittee is chaired by Tom Graham of T.H. Graham and Associates. The Government Operations Subcommittee is chaired by the Honorable Martin O'Malley, former Governor of Maryland, and Ms. Rosie Allen Herring, President and CEO of the United Way of the National Capital Area, chairs the Human and Social Services Recovery Subcommittee. Dave, I'll turn it back to you.
Yep, and as we've talked about already, the county executive asked the task force to release our recommendations in 3 phases. The first report we had, Actions Today, was released in November of last year already. The second report, called Visions for Tomorrow, which contains the Taskforce short-term recommendations, was released in January of this year. And now we're on the final recommendations, A Redefined Future, which are being released today, March 17th. You're going to hear a continuation today of the task force work towards positioning Prince George's County to emerge from the pandemic even stronger and more committed than ever. And this represents our collective work, assessing successful government programming and conceptualizing innovative ideas that will have implementation phases over the next 3 to 5 years. This is the third and final set of recommendations, again, following on the heels of Actions Today and Visions Tomorrow. So today we have the opportunity to present to you the Prince George's Forward Task Force, A Redefined Future. They're going to be presented by the 5 work groups, but I will note they've not yet been approved by the county executive. As soon as they're approved, we will post the recommendations on our website, princegeorgesforward.com. Each of the chairs is going to present what we believe are big, they're audacious and forward-thinking recommendations that are primed to continue the path forward for Prince George's County. We're going to present first economic recovery, then government operations, then education recovery, human and social services recovery, and finally health recovery. But we're going to start, as I mentioned, with economic recovery. And with that, I would like to turn it over to Mr. Thomas Graham, who chairs the economic recovery subgroup. Tom?
Okay, thank you very much, Dave. Let me start by saying that this has been a journey. And on behalf of the 20 members of my subgroup, DCAO Rogers, Brandon Starks, and the entire economic cluster, thank you for the opportunity to serve Prince George's County in this manner. If we go to the next slide, please. So today we have 4 recommendations. I'm not going to read through each slide, but the first recommendation has to do with creating a lasting capital access for small and minority businesses. The idea here is, in order to sustain our leadership in economic growth, we must build our small and minority businesses. This is very consistent with our prior recommendation to grow and market the Green Book. Part of this recommendation, there are 2 goals that you see before you, having to do with designing business hubs to provide lending assistance and technical assistance. And then also this effort would align with the FSC and other organizations within Prince George's County. Next slide, please. So our second recommendation is to develop a countywide resilience strategy. You know, as we all know, 2020 was financially challenging and impacted everyone in different ways. We had witnessed the fragility of economies around the world from a pandemic that no one had predicted. Some economists feel full recovery will not be achieved until 2023. But by developing a comprehensive resiliency strategy for both the government and business, we feel this is a critical step. And basically what we're trying to do here is get people prepared for any type of situation that might occur. You know, we've gone through a very challenging period, as I mentioned earlier, but our ability to keep business operations going and continue the kind of economic momentum that we had before the pandemic is something that we felt was critically important. And that's why we have it in our second strategy. Can we go to number 3, please? And the third recommendation is to develop a countywide workforce development strategy. As we've talked about before, pre-pandemic, Prince George's County was leading the state in job growth, probably over a 3-year period. And unfortunately, as a result of the pandemic, we've had a very high number, probably the highest number of unemployment applications in the state of Maryland. So what we're trying to do here is, I would say the concept is similar to what we proposed earlier, which was buy Prince George's County. Now what we're saying is hire Prince George's County. We want to hire Prince George's County through our higher education systems that we have. They're excellent institutions. We want to be as aggressive as we can in seeking state and federal funding. for any initiatives that we developed. And then also within the county government, we want to be able to hire Prince George's County residents. And, you know, the whole idea here is to make sure that the talent that we have in Prince George's County stays in Prince George's County. Next slide, please. So our fourth and final recommendation really has to do with a comprehensive look at all phases of the county's development process. So over the last 10 months, we've had exhaustive conversations within our subgroup about how we grow Prince George's County to meet its full potential. How do we overcome the negative rhetoric about Prince George's County not being business friendly? County executive, if you recall, you challenged us to be bold, and in quotes I have in my notes, go wild. So at each phase of this project, we have touched on economic development. We started with prioritizing shovel-ready projects. We then transitioned to the ombudsman position and customer satisfaction survey within DeFi. And quite honestly, I think that could also be a benefit to park and planning as well. But today we suggest taking a comprehensive review of the entire development process that would include the county, the district council, park and planning, and WSSC. It is not an indictment against any of these agencies, but it is a recognition that we can and must do better if we truly want to reimagine Prince George's County. So the 4 areas that you see before you, the first one I think is really important, to convene a group of technical experts and community stakeholders that would be appointed by the county executive with input from the county council. I think with this type of group of expertise, when you bring them together and then also you combine that with input from the county, you can have a better process moving forward. The second goal here would be to remove the call-up process utilized by the county council that triggers an additional review of proposed development projects that have already received a decision from the planning board and the zoning hearing examiner. The third goal here is to improve transparency in the planning process by incorporating expanded community engagement. And I think if there were, in feeling the team, where if there were greater transparency and more community engagement, the necessity of the call-out process may not be necessary. And then the final step here is develop a step-by-step guide for the entitlements process for each of the applicable zones to encourage investment in Prince George's County. These 4 recommendations were very thoughtful. There was a lot of discussion with regards to them, and the whole thought behind them was to make Prince George's County, a better place as we rise from this pandemic. So with that, I conclude my remarks. Thank you.
Mr. Graham, thank you. Before we move on to the Governor Operations Group, just remind folks, if you have a question, please use the feature on Zoom to show that you have a raised hand, and I'm glad to take your question. Again, you can either ask your question now or you can wait till the end if you want. With that, let me turn it over to Governor O'Malley, who chaired the Government Operations Work Group for the report on their long-term recommendations. Governor.
Thank you, Mr. Velasquez, and thank you, Dr. Dukes, for both of you for your leadership, and thank you, Angela also Brooks. It's been my honor to be a part of your outstanding team, and I think of not only my co-chair Terry Spigner, but also Wanda Gibson, who has been terrific. Also Sean Stokes, outstanding. Stanley Early, just top-rated people that you have in your administration. The Government Operations Work Group had the responsibility of making sure that we made recommendations very quickly for the continuity of operations, even in a pandemic where everybody's told not to come to work. That's a big shift for 240 years of self-government, when we were all about making sure everybody showed up for work to get things done. So These longer term recommendations build on the other ones that we've made on continuity of government, continuity of operations, the planning for that, and the steps that we needed to take in order to allow people to work remotely. It has been said by a great historian that humankind progresses in response to adversity. So for all of us, this pandemic has been a lot of adversity, but it has caused us to accelerate things that in the past we knew we needed to get to, but they always were kind of back burner. So this has given greater urgency to those. And now we need to build upon our short-term, our midterm recommendations along these following 5. Number 1, an enterprise-wide performance management system and dashboard. In one of the surveys we did of Prince George's workers, like 90% of our colleagues said that they feel like they're a lot more effective working from home. Well, feelings are important, but how can we actually measure that and see that things are getting done? That first gave birth to a short number of critical services that provided the executive the ability to see that we're delivering on the most essential services that county residents rely upon. But we believe, pursuant to the county executive's vision, that we need to stand up an enterprise-wide performance management system and dashboards so that not only the executive, but the people that she works for can see whether we're on task, whether we're on point, whether we're driving those leading actions that allow us to deliver a better quality of life for all of the people of Prince George's County. It has been called, I understand, County Stat. We've been working closely with Molly Byron and also Judge McCarthy stepping in as Tara Jackson took on her new roles as well. So that's recommendation number 1. Recommendation number 2 is to pursue the roadmap, the continued digitization of documents and processes. Digitization, big Scrabble word. In essence, what it means is that we have to create the ability, we have to move what had been paper-based processes, whether in permitting or licensing or regulation or zoning or many other things, into electronic forms so that people can collaborate and do their work remotely and still be able to access in a timely fashion the documents that they need to do those jobs well, to do them safely, and to protect the public. Third recommendation, and that is continued conversion of public-facing services, what was initially called e-government, the ability of citizens to conduct their business with the county, whether that's the business, as Tom Graham is so mindful of opening a business or maintaining a business or getting permits for a business, or whether that's simply the business of, serving your own family's needs, helping a kid figure out how to take a driver's exam, paying tickets or parking tickets or the like. So continued conversion of public-facing services to online. The third recommendation, I'm sorry, I'm losing track here. Fourth recommendation, excuse me, is to accelerate efforts at cybersecurity and cybersecurity enhancements. This is a problem that will not go away, and it is also a vulnerability that is very much increased when the work is done from several different sites or no site at all, namely people kind of dialing in, getting online from home, as we've encouraged them to do through newly adopted policies to protect public health. So Ms. Gibson could talk at greater length about this one, but it is all about cyber hygiene, yes, and also appreciating the threat landscape and what remote work does to open new vulnerabilities. And the fifth and final one is to secure the internet access that allows employees to work remotely. And I might add that it's not only about, when we say securing, what we also mean is building in redundancies and resiliencies and business procedures so that we're not asking employees to take on their own dime the cost of accessing the internet, but at the same time, given the essential services the county provides, we can't allow ourselves to fall victim to an outage if Verizon or a cable company or another network provider goes down. So secure internet access for working virtually. So those are our 5 recommendations. Finally, on behalf of Judge McCarthy and others perhaps on this call, I want to wish all of you a happy St. Patrick's Day. I want to compliment Dr. Dukes for choosing St. Patrick's Day, and County Executive also Brooks for choosing St. Patrick's Day for the time to unveil these recommendations. I will take it as a sign of great racial respect and not racial insensitivity that you have forced me to work on my high holiday. Thank you very much.
Thank you for that report. And I don't know how I follow that up, but I would just say if there are anyone that has any questions for the government operations recovery, I don't see any hands raised. Please go ahead and raise your hand. And not seeing any, we'll move on to the Education Recovery Work Group, and I'll turn it over to Dr. Darrell Pines to provide that report.
Thank you, Co-Chair Velasquez, and thank you, Co-Chair Dukes. Hard to follow Governor O'Malley. Happy St. Patrick's Day to everyone. We also celebrate St. Patrick's Day today as well, so we're excited about it. I just want to say, we started almost a year ago. I started as chair of this Education Recovery Working Group. And let me just say, County Executive Officer Brooks, it's been a pleasure to work with your entire team. Many new members of the county and people that have come to know over the last 8 or 9 months. It's just been a joy for me, have been 9 months as president of University of Maryland College Park. I want to also thank members of the committee support, which is Miss Madison Gray, who's just been a superb person to work for, and I'm grateful. Of course, she's a University of Maryland graduate, so I'm proud of her as well. And Dr. George Askew. Can't say enough about Dr. Askew's leadership and Department of Public Health for Prince George's County, and how he's worked with all the stakeholders in the state on health issues, but also on our committee. And of course, our committee is comprised of individuals who are presidents of colleges and universities like myself and my colleagues, but government as well, and corporations and community groups. So to all my colleagues who are listening in, who have worked with me over the last 8, 9 months, I'm grateful to them because most of these ideas have come from them. And with that said, we have 7 long-term recommendations that we would like to walk you all through. And so if you flip to the first one, we can start there. So, the virtual learning environment has kept not only the economy going in Prince George's County and the state of Maryland, but it's also kept education going. And thank God for technology. And I don't know if all of you even know that the internet, some of the origins of the internet, something called the Mid-Atlantic Crossroads, which is fiber lines that run right through Prince George's County, was one of the key enablers for us all to be operational as we are right now on the Zoom call. So one of the things that we discovered with education is that analytics for informed engagement and enhanced learning is something that we can actually leverage from having been in this virtual environment. So going forward, we want to formalize peer-to-peer interactions among students, peer-to-peer interactions among parents, teachers, which will support all of them online while also being cognizant of not having any misinformation go out to these different stakeholder groups. So we can now use efficient webinars on this Zoom environment effectively to communicate from, say, Dr. Monica Golson to her entire community, both students, staff, teachers, faculty, and of course, parents. So this has been one modality that we know not only can communicate with, but also get analytical data and see how folks are doing. So this is one of our long-term recommendations going forward. And it is a result of the pandemic. Number 2, please. Of course, coupled to this is what I started talking about earlier, is and Governor O'Malley mentioned this, and Tommy Graham mentioned this, broadband expansion and needs and opportunities and a gap assessment are necessary to ensure that the county is always connected and its students are connected to allow for them to be seamlessly educated through this modality. going forward. So we need to identify all strategic and tactical issues, as well as any impediments pertaining to expanding internet coverage in any of the underserved areas of the county, including rural, suburban, and urban. We also need to conduct a gap analysis to identify areas of weaknesses, absence of broadband coverage, which exacerbates, of course, the digital divide between our various population groups and, of course, our diverse student body. So that's long-term recommendation number 2. Number 3, please. So this is really more of a communication throughout the executive leadership chain of both the county council, the county executive's office, and of course, all of the stakeholder groups. So we want to be very agile and flexible and communicate through all the different leadership chains as the demographics for our county continue to evolve. We have immigrant families where English is not their first language, which need services. We have obviously students who are underserved in certain population groups. We have socioeconomic challenges. So we want to be communicating to one another effectively across the county on what best services to provide to the various population groups as the demographics of the county continue to evolve over time. So that's the nature of this particular long-term recommendation as it relates to education. Number 4, please. Financial maintenance work group for new technology. This kind of goes with long-term recommendations 1 and 2 as it relates to wireless and broadband and virtual learning. In the county, the Prince George's County Public Schools County Executive CEO, Dr. Monica Goetsen, essentially emphasized 1 device per student. But this is more about looking more strategically and tactically as we evolve and provide those devices to our students so that they can be educated, that we develop a strategic plan on how we're going to do maintenance over time to ensure that we're up to par in both software and hardware that allows our students to learn in the most effective way. So we need a strategic financial plan that goes with the execution of the implementation plan for delivering those devices to our student population. So that's recommendation number 4. Number 5, please. Leadership development. We're grateful to the county executive and her leadership, but leadership at every level, especially in the county school system. So we want to evaluate administrative certification programs offered through our local universities and colleges, while also developing a comprehensive leadership development program for current and aspiring leaders within the Prince George's County public school system and other school systems within the county, including higher education. We want to enhance leadership development among students by encouraging them to become entrepreneurs. So we want them to launch entrepreneurial programs within the school system to help build the next generation of economic development leaders who will run businesses of the future that will stay in the county. And so that's really moving forward, hopefully creating a couple of pilot partnerships between local universities and the public and private sector to help build those entrepreneurial connections for our student population in the county. So that's recommendation number 5. Number 6, please. We want to pilot the Maryland Promise Plus program, providing the on-ramp to higher learning and workforce development. So this is a strategy to enhance the pipeline and pathways to the educational enterprise to meet the needs of residents in our community by eliminating the obstacle of financial means as a sole determinant for educational success. The Maryland Promise Plus program will help students find the best fit for their educational pursuits and aspirations commensurate with their interests, abilities, and skills. Utilizing a last dollar approach, students and institutions will apply for federal, state, and other funds before applying for the Maryland Promise programs. But it's a way to eliminate the financial issue as an impediment for education at 2-year and 4-year institutions. Number 7, please. And finally, this comes to us as an area where teaching and learning and what we call VUCA, Research Partnership Program and Data Repository. So VUCA is sort of dealing with the uncertainty that we've all just went through in terms of the pandemic and how it's called volatile. The acronym is volatile, uncertain, complex, and ambiguous circumstances. So we need to develop a partnership on teaching and learning that can enhance student and teacher outcomes and engagement during this time period that we've all just gone through. And we now want to really put in a program that helps folks be able to be more resilient in the teaching and learning environment during things like pandemics. So that's number 7, and those are all of our 7 long-term recommendations on behalf of our subcommittee for the county executive. So thank you so much.
Dr. Pines, thank you. And again, anyone who's on the call, if you have questions, please just raise your hand and we'll make sure we get to them as well. And let me turn it over now to Ms. Rosie Allen Herring, who chairs the Human and Social Services Recovery Work Group, for a report on their long-term recommendations.
Thank you so much, Chairman Velasquez, and I thank both you and Chairman Dukes for your leadership. And certainly I honor our county executive for her forward thinking and allowing this to not only to commence, but the work that has been done by phenomenal professionals who have brought not only their thought leadership, but great amount of time and skill to this effort. I too would like to thank Dr. George Askew for his partnership and leadership on this effort, and certainly Ms. Madison Gray for her leadership in all that she has done to keep us not only on track, but keep us focused on the issues at hand. I do have to thank the great group of professionals, county executive, that you have appointed to the Human and Social Services Recovery Group. They do range from many out of the business community, certainly to the nonprofit sector, to county professionals as well. And again, we have 3 specific leaders who've worked on special focus areas that all of the group, all of the members were focused on one particular area. That is the Honorable Sheila Tillerson Adams, Aaron Bradley from AOBA, and Diana Leon Brown from Public-Private Partnerships here with the county. We have 7 additional, we can go to the first one, 7 additional long-term recommendations that are added to the 13 that we have previously given you, County Executive also Brooks, that we would like to see certainly taken forward as we look at the long view of where we believe it's going to take us post-COVID. The first one is dealing with communication accessibility and audit, if you will, and that's just simply to enhance Prince George's County's commitment to be in full compliance with the American with Disabilities Act. And it's by basically conducting an audit or gap analysis, if you will, to ensure that if there are necessary adjustments that have come as a cause from COVID, that we will able to support that. And this will again support communication access for all county residents with differing abilities as they seek to engage in civic activities and use county agency services during and beyond the pandemic. We will go to number 2. Again, we're looking at establishing an age-friendly county. One of the things that came up very clearly to us over the course of time was there was a demographic, primarily our aging and seniors, that found themselves dealing with a lot of challenges. And they were not just the food insecurity that was certainly much more prevalent across the entire county, but it was also for many of our seniors dealing with isolationism, who were not able to access many of the services that they had. We needed to make certain that we were looking at the gap analysis with and for them as well. And looking at the AARP age-friendly county designation as a blue ribbon, if you will, we are seeking to have us ensure that we do all of the steps to ensure that we have that designation by 2030. Again, working with our Department of Aging and Family Services, we just denoted that that was one particular segment of society that we could not leave untouched. The third recommendation, next slide, is look at our Family Stabilization Center. Again, we're looking to establish a program to address the needs of families that have faced loss, separation, depression, anxiety, lack of support, loss of security, and sometimes shame and embarrassment when there's a loved one that has been incarcerated, as well as certainly those that have been lost in this COVID season. And so we were looking to basically look at expanding the existing offerings to ensure that they are meeting the specific need that has been shared by many among us in our community. And so again, that's an opportunity for us to look holistically at our families and all of the age groups that have been impacted by this. The next one, number 4, is we're looking again at our All Access Food Services app. As we brought to you previously in our moderate term and short term recommendations, we're looking at establishing a smart county app. Initially, we also recommended a food czar so that we could coordinate and bring synergy to all of the various food offerings that are happening so that there is not an over distribution in one part of the county versus a low distribution in another part of the county when we find that there are needs. And this is simply helping us become much more efficient and effective so that we're talking through where the opportunities lie. So again, this is to help us with food insecurity that was already a challenge, County Executive, before COVID. It's simply been exacerbated by it, and it's certainly become a large focus for many in our county, but certainly across this region, where food insecurity continues to be a challenge. And we believe even post the quote unquote immediate crisis, that will still very much be a challenge. We can go to number 5. As you've heard from both the government operations, the education, as well as the economic subcommittees, this is an area of synergy literally for all 5 of us. And what you will find is looking at, again, making Wi-Fi access available where we don't have not only food deserts, but we have Wi-Fi deserts throughout the county by ensuring that we're able to use public facilities and establishing public hotspots throughout the county to ensure that everyone has the ability to be able to navigate on the technology that we have and need in order to have access for all of our employees. Again, for all of our citizens. Again, this is something that we're looking for 24/7. And again, it's in partnership with all of the other subcommittees as well. Our 6th one, next one, is we're looking at having a joint session with Housing Opportunities for All. Again, as we think about the challenges that have come from COVID, with many affordable housing issues being at the forefront, we know that there is a great deal of public policy around this, from the eviction and moratorium on eviction protections that are there, but some are about to end, to some of the existing areas of focus that I know Deputy CAO Rogers is working with all of the respective areas as well. So we're looking at basically having a convening session with all of the housing interest, if you will, to ensure that we're able to deal with not only the housing challenges that were there pre-COVID, but certainly those that have been exacerbated by this moment. And for some who will deal with the loss of affordable housing or safe and affordable housing, even because of this crisis. Again, we know that there are public policy initiatives that are there. We wanted to simply keep this at the forefront and make certain that there is balance with that as well. Our last and final, 7th, is looking at the social service referral portal. Again, this is an area that we're looking at having a public-private partnership with an existing platform where we don't have to recreate the wheel, but we have the ability to leverage something that we believe works well. And it's findhelp.org to integrate their data along with the data that we have here in the county's website to be able to amplify that access to others who may become knowledgeable about where the resources are and where the assistance lies. Again, as we look at this crisis, and we know that there are several long-term efforts along with, again, the 13 that we've shared previously, we know that we are indeed all in this together. This is something, County Executive, that we expect to see the residual effect for the next 24, 36 months of any of all of these challenges. We believe that the refinement will simply continue. And we believe that we're not looking for a new normal. We're not trying to get back to normal. We're trying to get to a better normal. And we believe that that is indeed possible. So thank you for the opportunity to work with the great professionals and to advance your leadership and your care for this community. Thank you so much.
Ms. Allen-Herring, thank you for that report and all the work of your subgroup. I did, as we move on to the next one, I did want to acknowledge Mr. Harrington's comment about the student connections to entrepreneurship. They put in the thing using Junior Achievement, which has a finance park in Prince George's County. So I did want to make sure that we acknowledge that comment as well. Thank you for that.
Thank you as well.
And with that, let me turn it over to Dr. Joseph Wright, who chairs the Health Recovery Work Group, and provide his report. Dr. Wright.
Yes, thank you, Co-Chair Velasquez. I want to welcome and thank the county executive, and particularly thank her for her vision with this recovery project, and also want to acknowledge the support of her team, DCAO, ASCU, and especially Senior Advisor Linda Turner, who have been instrumental in facilitating this work moving forward. The Health Recovery Work Group was made up of members across 4 subgroups that covered 7 specific focus areas: health operations, management and oversight, preparing for the next wave, continuing response needs, health department infrastructure, equity, strengthening systems of care coordination, and then finally filling the gaps. So with a collaboration of efforts, we submit to you 7 long-term recommendations to help build a refined future for Prince George's County. If we could have the next slide, I'll dive right into number 1 here. So this recommendation is primarily guided by the 2020 RAND study, which was commissioned by the County Council. Recommendations provided in the RAND study significantly influenced the work of the Health Recovery Group to evaluate how best to frame this recommendation and the path forward for the Board of Health function in Prince George's County. A guiding principle in development of this recommendation was the necessity to foster a stronger relationship between the executive branch, the legislative branch, and the county's health and public health partners, all with the goal of improving the overall health and well-being for all Prince Georgians. This recommendation includes 3 steps to strengthen the Board of Health function by strategically aligning its composition and responsibilities. Step 1, through legislation, the council would have the option to appoint additional designees to the Board of Health, expanding the membership to include individuals with clinical and public health subject matter expertise, and 2 members to serve in ex officio roles. Step 2, the council would collaborate with the expanded Board of Health composition as outlined in step 1 to develop an executive branch body to supplement the overall function. This executive branch body would be composed of public health and medical officials who are, again, subject matter experts to comprehensively address the health and public health issues affecting our county residents. Step 3, after changes in step 1 and step 2 have been implemented, the Board of Health structure and function will be assessed and adjusted to best meet the county's future needs and achieve strategic goals. I want to commend the County Council for resurrecting the function of the Board of Health almost 10 years ago and restoring it to a place of relevance. This recommendation is very much in line with that trajectory and recognizes the progression necessary to elevate the county's execution of its public health and health response mission. So that is number 1, and I've specifically taken time to walk through that one. This is a very important progression. The pandemic as well as the RAND report have made it very clear that we need to really focus on a continued development for our Board of Health function. Number 2, influencers. Community influencer program. The county executive referenced the vaccine effort going on across the county. This is clearly a very important element of the community influencer program, where individuals, some of whom are participating today on our full meeting here, who are influencers. They've been vaccinated, and this is just one example of where we could benefit and will benefit from those who are trusted voices and who the citizens will listen to and hear and receive information from. So we will extend this community influencer effort beyond the vaccination effort that we're undergoing now, and leverage that as a form of health information transmission and health literacy. Next, recommendation number 3, healthcare database of residents and their needs. Throughout the COVID-19 pandemic, we've recognized the fact that not having a granular grip on our county residents who have underlying conditions and require services beyond what the acute need may be has been an impediment to providing optimal care. So this recommendation speaks to developing a database where our first responders would be aware of individuals who have underlying conditions, for instance. And also this way we could ensure the necessary services that individuals need in real time are available and be much more proactive about providing these services. So this database is a tool that will help us on the front lines be able to be more responsive. Number 4, developing best practice models to guide behavioral health towards a fully integrative system. If nothing else, the pandemic has laid bare the need for comprehensive behavioral health capability in our health and public health system. So this recommendation is aimed squarely at developing a best practice model to guide the health department's behavioral health division, recognizing best practices. We don't have to recreate the wheel here. We can certainly look at best practice from other jurisdictions and leverage the talent and the resources here to meet the county's needs in this domain. This is equally as important as any other aspect of the public health function in the county, and the behavioral health needs will assuredly extend well beyond the end of the pandemic, the acute phase of the pandemic, as the dramatic impact on families and citizens will have its effects beyond the immediate pandemic. Number 5, health department addressing future county health needs. This recommendation speaks to a top to bottom assessment and review of the health department's current organization and capabilities. This is, again, something that has been challenged through the pandemic, and this recommendation will be the next step to creating a sustainable and right-sized health department budget without as much dependence on grant funding, and really making an investment in the public health from general funds, modernizing its operations. One of the examples we talked about was upgrading the IT capability and the information systems that are necessary to monitor, track, and interface with other jurisdictions. For instance, I think an example that I've referenced more than once is that in the pandemic, this is a regional pandemic. The virus doesn't stop at the jurisdictions that border us, and we need to be able to interface seamlessly with our neighbors in order to be able to track the epidemiology. So again, looking forward to that assessment, that top to bottom assessment. Next recommendation is to expand the Prince George's Health Assurance Program. And this is a program aimed at those individuals who are not eligible for other insurance coverage and are uninsured county residents. This is a safety net program, and making sure that we have adequately funded and provided the financial resources, and also resources through supporting our federally qualified health centers, which are designed to provide care for individuals who don't have other forms of coverage. And then number 7, last recommendation here, not only are we living through the last stages of a pandemic here, but we certainly have also had a reckoning with regard to social justice over the course of the last year. And this recommendation speaks specifically to training, social justice, diversity, equity, and inclusion training for county employees and contract employees. And our group thought this was an important exposure for anybody who is working in the county, either as part of the county workforce or contractors, to be exposed to this training. So that concludes the recommendations from the Health Recovery Work Group. And again, we all thank you on behalf of all the members, and I want to thank them specifically for all of the hard work to generate these recommendations, to present them today. Thank you.
Dr. Wright, thank you for that summary of the work you've done. And next on the agenda, we need to move towards voting to advance the recommendations. But before we do that, I wanted to make sure if there are additional comments or questions that we answer all of those before we move that. And I see Mr. Flores had provided a comment on number 5, hotspot hangout program, wanting to make sure homeless students are included in this recommendation by offering Wi-Fi spots at public schools, colleges, universities, parking lots, and alike in order for students to have access for schoolwork, but also access to jobs and medical help. So thank you for that comment. Noted and important that we make sure we do that as well. I'll give it another minute if anybody had.
This is Charlene Dukes. I do have a few questions, if any, but we'll defer first to our colleagues who are on the call and in the meeting.
Yep. And if I may, Madam Chair, Mr. Chair, just know that we have taken Mr. Flores's recommendation down for Human and Social Services.
Thank you.
And if I may respond, Co-Chair Velasquez, to the same concern, we discussed the homeless situation for children and for education, and that was a similar recommendation of expanding the number of hotspot locations in public facilities around the county to ensure that those students could be educated, as well as providing pathways for them to get on board. So,
great.
Thank you, Dr.
Thank
Pines.
you, Dr. Pines. Before we turn it to Dr. Dukes, any other questions from anyone? Dr. Dukes, the floor is yours.
Thank you. So I did have a question for a few of the chairs, and the first is for Mr. Graham. You talked about a resilience strategy. Could you give an example of what something like that might be and might look like? Either you or one of your committee members?
Yeah, I don't know if Mark Lawrence is on, but I can start for sure. Thank you for the question. So, when we're thinking about that, similar to if you think about, as you prepare for you prepare as an individual resident for your home. So what do you say? You always need kind of 6 months of money in the bank, to, for a rainy day. I think with the fragility of some of our businesses that we've seen, because we've seen a large number of businesses close. And if you look nationally at some of the numbers, you would see that a large percentage of those businesses will never reopen again. So if there were a strategy behind creating some type of a backboard for them, so they could sustain this type of situation that takes place, whether it's a pandemic or anything else that may come about, they would be better prepared, and the government would be better prepared to provide assistance to them as well. We've come up with some recommendations kind of on the fly, and I think the first set of recommendations that we had in quick wins kind of addressed some of the immediate needs, but I think there's an opportunity for a much longer, more thoughtful strategy that could be implemented and be in place in the event that something like this happens again.
Thank you. I didn't know if you had a committee member. I think I saw Mark Lawrence is on the call. If he wanted to add anything, he certainly is.
Mark is there. He worked on the, he worked on this particular, I would say Mark spent a lot of time working on this recommendation. So go ahead, Mark.
Yeah, I'm on the call. I think just to add what Tom said, it's really about taking a system level view and with data, and we focused on the economy. We do talk about doing it countywide, but what are some of the industries? And a lot of this is covered by some of the economic development strategic plan, but adding how do we prepare the workforce system, the education, how do we prepare residents? How does it determine how we develop places around Metro? So it's that system level view, and it's having it focused on what we call we were talking about as a North Star, right? So it's an overarching vision of what we want the economy to look like, and how do we make sure that all the systems, tools, and organizations are sort of marching to the same beat to do that.
Thank you. Thank you for that. And my next question is for the Government Recovery Group, Governor O'Malley. And you talked a lot about continuing with the digitization of some of the workforce streams. And can you talk a little bit about what's required to have some collaborative efforts to ensure success? What does that look? What would success look like at the end of that?
In terms of the digitization of the records?
Yes.
I think if success at the end of that process would mean that pick a good number, of the top 20 requests from outside of government, whether it's from citizens or whether it's a citizen in a business context, look at the top 20 requests or 80% of the requests. And if those requests can be fulfilled, responded to, a decision made by a county employee remotely, accessing electronically whatever public records need to be accessed for him or her to make that judgment determination. Here's your permit, here's your license, here's whatever it is. I would say that's a success. And Wanda Gibson, beginning actually with Sean Stokes' shop, has developed a roadmap based on how many business processes and therefore how many citizens each project impacts, to determine where it fits in the pecking order of that roadmap. You know, which things we go after first. We want to begin with those things that affect the greatest numbers of people, and then work our way down that list from the most fruitful to the least in terms of public impact. Although we began with HR, you know, the ability to hire people and those sorts of things, because it was also intersected with the mission of continuity of operations and continuity of government in a pandemic. But small things done well make bigger things possible. And I'm sure Ms. Stokes would tell you it wasn't a small thing for her to be able to digitize as many of their documents as they needed to put into electronic form in order to do their job of processing county employees and their needs without interruption.
Hey, Dr. Dukes?
Yes.
If I may, Governor O'Malley, is this kind of the same concept of, you know, in the medical field, there's a lot of digitization of medical records, which provides greater connectivity for doctors. And so you're able to provide better services for patients. And if you kind of translate that into the government space, then you would also say that it brings departments, agencies closer together so they can be more effective and more efficient for the citizens. Is that the concept?
Yeah, I think that's, Mr. Graham, I think that's not a bad analogy. I think there's, this is, I know I didn't answer directly the collaborative benefits of this, but I think the collaborative benefits of this will be many. We tend to, it's one of the themes you always hear when you want to coordinate, cooperate, and collaborate better in government is somebody throws up the flag and says, but our data is in a separate silo and it's kept in a different format. So this is one big way to break down the silos, at least insofar as they protect from viewing paper documents that need to be seen and need to be viewed. And perhaps, you know, there's levels of collaboration that will happen informed by access to those documents that's less cumbersome than going in and paging through paper. Maybe there are things that can be learned in terms of better diagnostic tools or better predictive analytics and all those fancy buzz terms, which is just taking data from what we already know so that we can do a better job of what we already know how to do, and to do it more timely, both strategically and tactically. So I think the medical records thing is not a bad analogy. In this case, they're mostly, the big chunk are those property records, building records, and those sorts of things, which typically have been done on plats and paper, and people having to file things in triplicate and paper. And to your point, Tom, about issuing permits on a timely basis, I mean, one of the reasons some permits and business people and developers have complained about the time it takes is that it's all been done kind of sequentially on paper. Once you get done with the plans and the paper, you walk it over to the fire department to approve it. Of course, it's never walked over the same day somebody looks at it. They wait till there's a stack on their desk, and then they make that trip over to the fire department. But when things are digitized and be seen from many different agencies at the same time, it's almost like GitHub for code writing, right? I mean, it's kind of like GitHub in that people can work collaboratively and remotely and concurrently on the approval of a permit, rather than step 1, step 2, step 3, step 4, give me a 20 or a case of beer to move your permit, you know? And with greater openness and transparency and all the benefits of measuring that performance, you know, and perhaps even a greater degree of security, because there's that, I mean, can be that electronic fingerprint on who accessed the file.
Okay, thank you.
Thank you for not just the responses, but the examples of how that could work. So my next question is for Dr. Pines. And Dr. Pines, you mentioned two things that were intriguing to me, even as I read the recommendations late last week. And the first is the financing for a sort of one-to-one for students in the public schools, as we keep thinking about what they need to be provided in order to just to learn in this world in which we're going to find ourselves. And I would believe that you would be one of the first to say that there are so many lessons learned throughout this, that our ability to go back to fully what was in place prior to March 15th will actually change, and we may never go back fully to that. But how did you all think about it from the perspective? I get the K through 12 and maybe some of our other sort of non-public schools that are educating folks pre-K through 12. How did you all think about that from a higher education perspective? Is there an opportunity for some collaborative financing around the kinds of things that even in higher education, you, Dr. Bro, Dr. Williams have had to provide?
Great question. Let me tell you what has come out of this for us, and for me personally, as it relates to your question. President Williams of Prince George's Community College, who's on this call, President Bro of Bowie State, and myself, we're now having these really strategic conversations that thank you, County Executive, that we were not having 9 months ago, about how we can better make it seamless for students in the county to come through our institutions with no barriers in every way, right? Academic, affordability, other issues. We are also, just to let you know, that we're meeting with Dr. Monica Goldson, the four of us are meeting on, at a minimum monthly, to discuss other areas of interest to just K-12 and how we can better partner with Dr. Goldson, and she has some great ideas on what we could do to help streamline the process. With respect to the digital gap and the devices, so in higher education, we are constantly looking at issues related to, do we have the right software tools and the right hardware to advance our mission? We now have looked at that a little bit for K-12 and pre-K. And as in every technology era, things evolve, things change. As an example, we are all currently on Zoom, but the next generation of Zoom is coming, and we need to be prepared for that. So that's what we mean by the financial maintenance and strategic thinking, that this is where we are today, and it's work that allowed all of us to be on this Hollywood Squares sort of scenario to speak to one another and communicate and carry business forward. But the next generation is much better. And so we, through the pre-K through 20 system, must be looking at that to advance virtual learning and other modalities of learning going forward. I'm just giving you one example. and that's just the Zoom. And those are the discussions that we need to be planning out in the county, finding the resources that may come from the state, that may not come from the state. We may be the case that we have to do a few proposals to the federal government to get funding. So these are the strategic now conversations that we'll have going forward after we turn in these long-term recommendations with Dr. Goldson, with my peers who are presidents of my peer institutions. So I think it's pretty exciting. And most importantly, I'll conclude with, we've established some really just good relationships and communication channels that we didn't have open maybe fully before.
Oh, thanks a lot for that. You know, Dave, I'll turn it back to you. I could ask questions of Ms. Allen Herring and Dr. Wright, but I also want to be cognizant of the time that we're in. So I'll reach out to the two of you individually after the call, but most interested, so you know, in the SMART app that you spoke about, Ms. Allen Herring, and how that also plays into this whole digital divide. You know, because we can have a SMART app, but if I don't have a device, it doesn't matter. So I think that's something that's interesting to me as we think about how we turn the recommendations over to the county executive, and both our thinking through it, and county executive also, Brooks, you and your leadership team thinking through it, so that we know that these longer term recommendations don't have to be completed in year one, but you know, we can say, what does a phase in, phase out look like relative to what you're hearing today? And Dr. Wright, just want to thank you for your leadership in partnership with Dr. Askew, Dr. Carter, with the health department, because we know that we continue to be anxious and tense and stressed out, even as we are getting our shots, whether it's Pfizer, Moderna, or the new Johnson & Johnson single vaccine. But knowing that another pandemic is likely to occur at some point, and maybe it won't be 100 years from now, how we step up to ensure that there is not just a crisis plan in place, but that we have the kind of staffing and support that's necessary as we continue to move through this one, was really gratifying to hear that still remains top of mind. So with that and those comments, Dave, I'll turn it back to you to get us back on track with the agenda.
Dr. Dukes, thank you. And again, as we get ready to vote as a task force to move these recommendations on to the county executive, again, just thanks to all the work group chairs and everyone who's been on the work groups. I know it's been a long number of months, not just working on the task force, but everything else that's been going on in everybody's business lives, personal lives, et cetera. So, you know, your dedication and commitment are extremely, extremely appreciated and have been critical to the success here. So with that, I know on Zoom it's very hard to do votes, but I would like to have someone put on the floor a motion to move the recommendations to the county executive. So do we have someone who will move that?
So moved.
Second.
And second, thank you. With that, I'll just ask if there's anyone who objects to it, please voice your objection now. Otherwise, we'll assume that it's moving forward unanimously. Not hearing any objections, the recommendations will move forward to the county executive with the unanimous recommendation of the task force for her and her administration's consideration on that. With that, the next thing on the agenda is a brief communications report, and I apologize, I'm not sure who is providing that, but Sheila, are you going to be providing that?
I will be.
Okay. So let me turn it over to Ms. O'Connell to provide that update for us.
Okay, great. Thank you so much. And just thanks for inviting Kate Coleman and I at McKenna Media to be part of today's meeting, full meeting of the task force, and as well as just part of this great team that's leading and guiding the recovery efforts. It's been a real pleasure, and it's been a lot of fun as well. County Executive, you put together a great team of smart, hardworking people, and we've had a great time trying to promote and lift up some of the activities. Quick thing on sort of next steps here for us. with the sort of pending imminent release of the next report, the last report, we'll look to do another one of the usual sit downs that we do with all of you as task force recovery group leaders and our co-chairs. But we'll also, with the culmination of the task force, look for opportunities to do longer sit downs, and not just on some of the recommendations, but on the whole work of the task force. Because as the county executive said at the beginning of this meeting today, we're really starting to round the corner in the fight against the pandemic. And the task force was obviously built for this moment. So the framing of the work that we have, the framing of the work to date that we've been doing, it sort of changes a little bit in this moment. And we know that, reporters will soon stop writing about just about the daily virus story and the daily distribution story, and start to look forward towards the recovery of the region, life post-pandemic. And we are going to put the task force right in the middle of that conversation, because that is, of course, core to the mission and what the task force was set up to do. So we look forward to working hand in glove here with the county executives, communications team as soon as this report is final. David Sloan and his team also asked us to do a quick run through of some of the communications work that we've done to date. So just as a sort of small top line wrap up, we've done these regular press calls with the co-chairs and the subcommittee chairs, and those have typically had like 9-ish media outlets represented on those calls. You guys, we've really appreciated the social media kits and the sample posts that we have sent out, that you all then have in turn used to post and to use in your digital feeds. We had a great, in October, Dr. Pines, along with Dr. Bro and Dr. Goldson, were invited guests of one of Congressman Brown's weekly webinars. And in that October session, they had almost 17,000 people view that meeting to hear about the different recommendations that affected families who had college-bound students. So I put that number out there, Dr. Wright, that there were nearly 17,000 people, because Dr. Wright is going on next week as the chair of the health recovery group to go on to Congressman Brown's webinar to talk about vaccination. So that is the high water mark that you have to hit from Dr. Pines' work there. Governor O'Malley hosted a Zoom call talking about the Actions Today recommendations on government operations. And, that was a great example, actually, of the governor using his Twitter and Facebook assets to post information about the open Zoom call that was open, and as well as the Human Resources Department had also emailed employees. They had a chance to hear about the sort of recommendations that the task force was creating. So we had about 100 people participate in that call, so that was great. Ms. Rosie Allen Herring went on Prince George's County Television to discuss recommendations for seniors. We also did some digital promotion of the first report, which had about almost 200,000 impressions. And what we liked there was a pretty decent click-through rate of people who clicked on the report to learn more about the recommendations. And then recently, the county executive, along with Drs. Wright and Drs. Carter, joined Dr. Anthony Fauci to do this 20-minute Q&A. And that had a tremendous amount of media coverage. All the news stations all covered it, and we had some statewide news coverage as well of that 20-minute, really great just Q&A on some commonly asked questions about the vaccine and distribution. David's team also dubbed that into Spanish, and so his team is working to get the Spanish language version out into the community as well. So I will end by saying thank you. It's been a real pleasure, and we look forward to our last couple of weeks of really driving home the recommendations of this last report.
Thank you for that, Sheila. And it's been a pleasure, certainly, to work with you and McKenna Media, and for everyone to hear the kinds of activities that have been going on. And in addition to this brief communications report, we've also asked for some periodic progress reports so that we can share with the full task force and the public how the work is getting done in a transparent manner. So Dave is just going to take us very quickly through what we've been able to do to date with the actions today and the visions for tomorrow.
Dr. Dukes, thanks. And it's been quite impressive, you know, how the county has moved forward under the county executive's leadership. So the actions today are quick wins. There were 47 proposed. Of those, fully 38 were approved. 8 are already fully implemented. Another 20 are in progress, and 10 have yet to be or will be initiated. So great progress there. On the visions for tomorrow, or the short-term recommendations, there were 34 approved, or 34 proposed. Of those, fully 28 were approved, and all those are in different phases of implementation as we speak. So a lot of great work there in moving those forward.
And I also think that, you know, the task force and the public should know that we are probably talking somewhere over $31 million worth of recommendations that were approved in terms of the dollar amount. And that the county executive and her team have worked to fund those recommendations, and again, they're in the implementation phase. You know that we already know that we voted for 29 recommendations to be forwarded to the county executive, and Dave and I are going to be meeting with her and her leadership team to answer any questions prior to announcing the approved recommendations. Once that occurs, we'll communicate with the task force and other key stakeholders as we prepare to put them up on the Path Forward website. We're also scheduled to present an overview of this final set of recommendations to the County Council on Tuesday, March 23rd, and to the community stakeholders group on Wednesday, March 24th. So David, I'll turn it to you as we move to closing remarks before we turn it over to the county executive.
Thank you. And you know, as we're closing down, wanted to again, Dr. Dukes and I wanted to thank all the 60 members of the task force for the time, the attention, the energy that you've put in to making sure that we have a better present and a better future county that we all love. I want to also thank the more than 50 government deputy chief administrators, directors, and staff who contributed to all the work that we've been doing over the last 10 months. So thank you to both groups as well, and also to all in the county government who are going to be involved in implementing now all these approved recommendations. We've all been united, which is great in the long haul in our commitment to get Prince George's County back on its feet in the most robust and also the strongest way possible. This last report, this last phase, allows us to achieve the collective charge we had from County Executive also Brooks and the larger community as well, to embrace and activate a mission of fully reimagining Prince George's County and how you and your government will evolve over time. So again, thanks for all the work that you've done.
So we know that when we adjourn today, that the work that we've done will continue. One is because we need to finalize the full report for internal review, approval, and implementations, and the public's consumption. We want to make sure the public is very much aware of all of the work that has gone on and the work that will continue. As co-chairs, Dave and I again want to publicly thank the chairs and the respective members of your work groups, without whom none of this would have been possible. You know, we talked about commitment, but it was also tenacity and resilience. It's much appreciated, and we are grateful. We want to acknowledge roles and Zara Isaacs and Tangi Allen. We appreciate the opportunities we had to present to the County Council, the community stakeholders, and to answer questions from the public through our email site. The insights that we gained and the thoughtful engagement assisted us in thinking more deeply.
This task force would be a productive project. We worked hard to find the right people to provide thoughtful insight on Prince George's County and help us to chart a course forward. Today, I am pleased to say that my highest hopes were surpassed. Once again, I want to thank every member of the Forward Task Force who has dedicated time and effort to the cause of improving the quality of life for Prince Georgians. We were hit hard by this pandemic, but we've all found the strength in our tremendous sense of community that surrounds us today and every day. Each of you is here as an expert and because you care so deeply about Prince George's County. I want to thank you for being a part of this community and for embodying its spirit of kinship, sacrifice, and thoughtfulness. As I've said before, I trust the advice that I received from this process. And as we conclude this last official meeting of the Forward Task Force, please know that your work here has made all the difference in the lives of Prince Georgians. I especially want to say thank you so much to our illustrious chairs, to Dr. Dukes and to Mr. Velasquez. Thank you so very much. First, for accepting the call to lead this group, and then to each of you. Again, the herd that we have put together, the amazing tribe who have come together to make sure that Prince George's County is able to move forward. I am forever grateful to each of you. I thank you again for your time, for lending us your expertise. And you know what? I look forward to enjoying a brighter future together. I appreciate each of you. To Governor O'Malley, happy St. Patrick's Day, and how we could hear from your band tonight. But you know what? Because of the work that all of us have done and because of these vaccines, soon and very soon, we're going to be able to come together again to enjoy all that we've enjoyed with family and friends. And we really thank you for helping us to get there. I did ask you to go. I think you did. I know that you did. Your recommendations show as much. So thank you again so much to each of you. Please continue to care for yourselves and your families. Thank you so much. God bless all of you, and may God continue to bless our beautiful county.
And I will say, as a final comment, Governor O'Malley, did you want to say something?
I just want to say heard but not seen. HERD. Thank you, County Executive. It's been awesome to work with your great team.
Thank you.
I will say that unless there is an objection, this meeting shall stand adjourned. And thank you all. As members of the task force, you will get one last email from us asking for something that we hope will be very special, but we could not have done this without all of you. When we called and you said yes. And I remind myself that Dr. Pines and I had not even met, but he said yes, and I think he was moving into his first days of taking on the presidency of the University of Maryland College Park. So thanks to all of you for your friendship and for your professionalism and just for leaning in with us as we continue to move our great county forward. And again, I see no objections, so we will adjourn this meeting. You all take care, stay safe, and if you need that vaccine, make sure you call Dr. Wright to be an influencer. Take care, everyone.
Thank you.
Bye-bye.
Thank you. Take care.
Thank you.
Take
Bye-bye.
care.
Oh, Joe, I hope you're ready for the calls.